Hey everyone, it is Dr. Heather, your virtual sports chiropractor. And I think a lot of us actually wonder if we've gotten a muscle strain, but are not 100% sure what it is. So I figured let's actually break that down because I think a lot of us, we're going out there, we're doing our activity, and we may be noticing some aches and pains. And we're kind of starting to go to our two types of resources, which happen to be Facebook and YouTube. And we start kind of scrolling the internet and starting to figure out, what is it? What do I have? Is it a fracture? And our heads just start going and going and going. So what I wanted to really do with you guys today was really kind of break down what a muscle strain is, so you have a better understanding, how that type of injury works, what to look for, and really kind of understand the right way to treat it, especially in its initial phases. So like I said, this is a real kind of just educational bit for you guys on what a muscle strain is. And I'm going to bring up my slides so you can see. And I want you to really kind of ask some questions, because a lot of you who are training for marathons, maybe some Ironmans as well, you may be experiencing some just kind of fatigue of muscles, aches and pains, and really aren't sure, if it is a true overuse injury or if it's leading to a muscle strain. So what we're going to do now, I'm going to pull up my screen so you guys can see it. And here we go. Okay, so muscle strain. So I'm sure a ton of us, when we've gone out there and we've started doing some running and things like that, we notice that we're developing some aches, some cramps along the way. So what I want to kind of go through with you guys is really just having that basic knowledge, what a muscle strain is. So this is an injury to the actual muscle or tendon. We have fibrous tissue that connects to the bones and to the muscle. And these are usually considered like a minor injury, where maybe the muscle has become a little overstretched or the tendon, but then it can actually lead to a more serious injury if we don't kind of deal with it right off the bat, or if we try to keep running on it or utilizing that muscle. So some of us might be doing some training activities, a muscle strain may set in, and we may continue to push that muscle group a little bit further, whether it's increasing our mileage when we're out there running, or maybe you're trying to now start to lift a little heavier and you're going through what we call like repetitive movement patterns. And now all of a sudden that muscle strain is starting to become a little bit more severe. It's starting to become a little bit more intensified, and you may actually notice like a tear or feel a tear within that tissue. Now, when we look at muscle strains, there's actually three grades to the muscle strain. And as you can see from the picture I'm illustrating here, a muscle strain can actually lead to a complete tear of the muscle. And I'll share with you guys like a simple little story that actually happened to myself. And I'm sure a lot of you can relate to. I was helping a friend. She was getting ready to train for her first kind of real big, full, actually it was a half Ironman that she was getting ready to train, and she wanted me to go ahead and do some of the running with her. And we were doing the Boston build-up training program. It happened to be dead of winter. It was January. We were having record low temperatures out here on the East Coast. And we were also having a lot of wind chill factor. So yes, even though all of us were really bundled up, when we started running, unfortunately, I don't think my muscles really kind of warmed up because it was that frigid out. And as I was going along, and it was only like a 5K, it wasn't anything, strenuous. But as I was going along, I could feel that the muscle was starting to strain. And sure enough, I started to kind of turn a corner, and I could feel the whole muscle really start to tear. Now, the next day, I had a lot of bruising around that area and stuff like that. So my muscle strain actually became much more of a classification of a grade 2, grade 3, and it allowed me some very sad news of not being able to train really for almost a good 2 months because it was that severe, and I was having a lot of trouble just contracting that quad muscle. So this is where I want you guys to really understand the different grades of a muscle strain, so you have a better understanding of what's going on and how to better deal with this, for yourselves. So grade 1 muscle strain, just as it says here, mild damage to that muscle fiber, we're looking at less than 5% of the fibers that have been, kind of damaged. You're going to notice minimal loss of strength, and you're going to notice obviously minimal loss of motion. As we proceed and we get into like the grade 2 type of strain, this is where more extensive damage is going to set in. This is where you're also going to notice that the muscle hasn't completely ruptured, but you're going to notice that the strength of the muscle. So for me, I was noticing that I was having a lot of trouble extending my lower leg. I was having a lot of trouble kind of contracting the quad because my muscle now was starting to become more of a grade 2 type of strain. And this is where, you want to be very careful about how you return to activity. Even if something's feeling pretty good, just, err on the side of caution, ease back into everything, because a grade 2 muscle strain can take anywhere from 2 to 3 months to really kind of feel like, you're ready to go back to activity. Now, a grade 3 muscle strain, this is where we talk about there's that complete rupture of the muscle or the tendon. And this is where you're going to feel like a palpable defect. A lot of people sometimes notice a a grade 3 muscle strain. Sometimes that can happen in the bicipital muscle. They'll notice a torn biceps tendon. That actually is probably more of a type of a grade 3 muscle strain. And this is where you'll notice like some swelling, all the bruising and stuff like that. And this is the one that will require surgery and obviously proper PT to go ahead and really have that put together. Now, again, some people may disagree with me here, but when we look at treatment of a muscle strain, we really do want to do the RICE recipe. Okay. Now, this is initially right at the incident of impact, meaning it just happened. So you want to take advantage of that rest period. It is crucially important. And that is really resting for that 48 hours. After it's happened, you do want to take advantage of using ice as much as possible. And it is, depending on the surface area, it's 20 minutes on, 20 minutes off. And you do want to make sure that you don't create any frostbite around the area. So do, make sure you put something between you and the ice to prevent that. And also too, looking at compression, taking an ACE bandage, or if you have some compression sleeves, if it happens to be a lower leg injury, or, using a compression sleeve around the quad itself, because those are kind of like the common areas where we can see muscle strains happening. You want to go ahead and compress to help reduce the swelling. And then obviously you have elevation. Now, again, these are the classic treatments for a muscle strain. Now, once you're beyond that 48-hour period, you can definitely get in there and start doing some myofascial work. And if you know me, I'm huge on myofascial work. So when an injury happens, getting in there and really starting to dig out the tissue, getting those fibrous tissues to really realign themselves, is going to help make it stronger. So this way also too, as you return to injury, you're not going to have an injury that's going to set in or something else that's going to happen along the way. You're going to notice that the area does feel stronger. Now, like I stated, this is a classic overview of a muscle strain that I really wanted to give you guys, because I think a lot of us, as we're starting to train a little bit more, we don't know really what to do with a muscle strain, and we don't know how to distinguish it and what is the right protocol. Now, like as always, if you have questions, ask, go ahead, drop me some comments down below. If you want, you can always take advantage of booking a free consult with me. Head over to AskDrHeather.com and book that consult with me. I'm happy to talk to you guys further about whether it's a muscle strain or a muscle sprain, whether it's a tendonitis issue, or it's something else going on. And as always, as I always mention to you guys as well, check out my myofascial course. My myofascial course has a ton of great information in there for you guys. Really takes a head to toe approach at looking at breaking down the soft tissue so you increase flexibility and mobility, which is crucial to your overall optimal performance. All right, everyone. Now remember, if you haven't subscribed to the channel, please go ahead and do so today. And as always, if you found some value in this short little video on muscle strains, give it a like. All right, everyone. This is Dr. Heather, and I'll talk to you later.